Good morning, honorable members. Good morning to the support staff that is with us in this meeting, starting with the Secretary of the Committee, Ms. Machalamba. May I know, Ms. Machalamba, if there are any apologies in this meeting? Thank you.
Good morning and thank you, Chair. I'll first read the names of the members who have joined the meeting. Present in the meeting is Dr. Lomo, Ms. Shabangu, Ms. Clark, Dr. Leroux, Dr. Tembekwayo, Mr. Van Staden, and Ms. Mhlongo. The only apology that I've received is from Ms. Sene. She's joining another portfolio committee meeting at 11, so she will leave this one and join another one at 11. Thank you, Chair.
Welcome, honorable members. Before we start, let me just reflect this to all of us. Oh, there's another hand here. Can you just hold on with the hand? I'll just finish and come back to you, honorable member. Before we proceed, I'd like to remind all of us that this virtual meeting is deemed to be in the precinct of Parliament and therefore constitutes a meeting of the Committee of National Assembly for official purposes. In addition to the rules of virtual sittings, the rules of National Assembly, including the rules of debate, apply also in our meeting. Members enjoy the same powers and privileges that apply in a sitting of a National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been said in the House and may therefore be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when requested to speak. This is because the microphones are very sensitive and will pick up any noise which might disturb the attendance of other members. When recognized to speak, please unmute your microphone and then connect and also show up your video. Members may make use of the icons at the bar at the bottom of their screens, which has an option that allows a member to put up his or her hand to raise a point of order. The Secretariat will assist in alerting myself as the chair to members requesting to speak if I do miss them. When using the virtual system, members are urged to refrain from or desist from unnecessary points of order and interjections. We would really like to just conduct this. I thought this, while some of us might be familiar, but for the new members and all of us starting, it is important just to reflect on these rules. May I therefore recognize there's now two hands I see. Is it Carl Leroux? And there was another hand of Honorable who logged in as Betty. There's now another Honorable Fisa. In any particular order, those who have raised their name start with Carl, go to Honorable Fisani, and then the third one would be, oh, this is Dr. Leroux, Carl, yes.
That's correct.
And then Betty. Are you indicating that you are part of the meeting or you have another point?
No, I just wanted to let you know that on the WhatsApp group, we've just received an apology from Dr. Leklape as well.
Okay. No, an official apology from Dr. Leklape, Honorable Dr. Leklape. Honorable Shabangu.
Well, thank you, Honorable Chair. Kumalo is struggling to log in. I don't know whether she will be successful. She just sent me a WhatsApp now that she's struggling to log in. Thank you, Honorable Chair.
Thank you very much. Another hand from a phone called Betty.
Thank you, Chair, and good morning, comrades. My apology, I'm unable to correctly rename. Betty Kihakilwe, I'm a member and I'm present. Thank you.
Okay. There's another one from Meta.
Oh, Chairperson, it's Mr. Mutubatsi, I'm with Mr. Ngeta. Gwabaze, I'm just struggling to log in. Patrick Mutubatsi, I'm present.
So, Honorable Mutubatsi, you are logged in the same gadget with Honorable Gwabaza.
Yes.
Okay,
Yes.
so will you note that Honorable Ms. Machalamba, 2 in 1? Thank you very much. Dr. Tembekwayo, I note your hand.
Good morning, Chairperson. Can you please, we are not comrades here. Can you please get the thing right? We are not comrades, we are honorable members, please.
Okay, I would like members to keep on revising that, what Dr. Tembekwayo has raised. Thank you, Honorable Van Staden.
Morning, Chairperson, colleagues. Chairperson, not to be difficult this morning. I just want to know why we have an online meeting. Is it because there wasn't a chamber available for this meeting? Just for clarity, please. Thank you.
Yes, firstly, the two processes. We requested to have this meeting. I'll just unpack immediately why we needed to have this meeting. And then the meeting was therefore granted by Chair of Chairs. And then the portfolio committee secretary came back to me to say, Chair, even though the meeting has been granted permission to proceed, the venues are unavailable. As we are hearing, there are some other members who have actually logged into other meetings. So I said, look, challenges that it may be, some of the members I knew, I'm glad they are able to log in. Let us actually have this meeting, which may not be too long and may not be too difficult to handle, and hence the reason for requesting that we do log in virtually. Thank you very much. I hope that I saw your thumbs up saying, yes, you are happy with this explanation. Thank you very much.
Chair.
Thank you.
Thank
Ms.
you.
Machalamba, can you flight the agenda for this meeting? Thank you. Gone through the first part of really opening. I still want to maybe add a bit of it will come in as we look into item of considering the report, the attendance and confirmation of those who are logged in. Thank you very much. You have been able to log in welcoming you. Let me then indicate that this agenda senior is what we'd like to go through: confirmation of the legacy report, consideration and adoption of the minutes, which I think was sent also to us, and then we'll close. Maybe then can you remove that, or maybe before that, can I request members to that we go through these two items, mainly the minutes of the previous meeting and the legacy report. If I could get colleagues calling for adoption of this report, of this agenda for our meeting. I'll recognize hands that come up, or a voice. I hope members do not want us to just go through the meeting without adopting the agenda. I'm calling for honorable members to adopt the business of the day. Honorable Dr. Susan Tembekwayo.
Thank you, Chairperson. I was just thinking that we can do the adoption of the minutes during the next meeting. Say we just concentrate on the consideration of the legacy report, if some members do agree to the suggestion. Thank you.
Suggestion of an amendment to the agenda, which is not really a train smash, that we just look into one item and therefore postpone the adoption of the minutes of the last meeting to the next meeting. Therefore raising one, an amendment, and two, the adoption of the agenda. Any seconder to those two proposals? Okay, I would see the hands that Leroux had his hand up. Look, colleagues, I do not foresee Dr. Leroux. We put you, Honorable Dr. Leroux, as the member who is supporting that proposal.
Chair, I put my hand up just to adopt the initial one, and so I I would like to see what the other members think about removing that. Perhaps we could see if anybody has any objections to the honourable member's request to take the adoption of the minutes off.
Yeah. Dr. Tembekwayo, I'm reluctantly agreeing with you because we are going to have a 3 weeks gap, and I would have wanted us, and I don't think it's more than 2 pages of those minutes looked into and then be adopted. But if other members support your amendment, let's hear that. Honourable Clerk.
Thank you, Chairperson. I mean, the legacy report is really just what we did in the last 5 years. And I've been through that report and it reflects our work. So that shouldn't take too long. And then the adoption of the minutes is literally a minute. So I think we should just cover the agenda and start afresh when we get back from recess. Thank you.
Honourable Dr. Susan.
Let me withdraw. Let me just withdraw. As the members say, we should proceed with the agenda as it is. It's fine. Thank you. I withdraw.
Okay. Thank you very much, honourable members. Therefore, let's proceed with agenda as is adopted. Honourable members, I really ask that we convene this meeting. Of course, honourable members that are here, Honourable Van Staden, Honourable Dr. Tembekwayo, Honourable Clark, and who else? A bit of myself. We do have an understanding of this report that is actually to be tabled. In other areas, they call it a closeout report. What was done in the previous administration, some of the things that were done and some of the things that were not completed. We felt that it would be important that we come to meet here in this meeting today, initially to highlight mainly the outstanding issues. Honourable colleagues, I can't remove that bird in my yard. I hope you can still hear it, the noise of the bird here. No, it's gone now. So that we could look into this report, get the highlights. For those of us who may still need a bit of time to read it, go home over this recess and look at it. Our wish is therefore that when we come back as this portfolio committee, taking what we are going to be seeing in this report, we can use part or some of it in preparing our plan, our draft plan as this portfolio committee, how we are going to actually execute our duty and our responsibility. So it was in that spirit, therefore, that I said, can we reflect? I'm glad that the report was sent to us as early as Monday. Yes, most of us should have read it, but we just thought if we could be getting secretary to look at the highlights, mainly the issues that are regarding to the issues that were done, outstanding issues, and what were some of the issues raised as challenges, and some of the recommendations that are in this report, which I think therefore should make a provision for us going forward. May I therefore request, if you do agree, that we get our secretary to highlight in some few slides that she had prepared to take us through in this report. If that is agreed, back to you, Ms. Majalamba.
Thank you, Chair. Ms. Ngomane will present the report. Thank you.
Before you do that, I see there are 2 hands. Oh, yeah, they are saying thumbs up. That is from both Dr. Susan Tembekwayo and Dr. Leroux. Okay, let's proceed. Thanks.
Good morning, Chairperson. Good morning to the members and to the colleagues. My name is Lindo Ngomane. I'm the content advisor supporting the committee, and I will be presenting the legacy report for the portfolio committee. Just to start off, to say that this report essentially captures the work of the PC during the 6th Parliament between May 2019 and March 2024. I'm not gonna go through the whole report, Chairperson. I'll just zoom in into the issues that you have highlighted and just get straight to the point. In terms of the key highlights, this just reflects the work of the committee per financial year. Just to highlight that in 2019-2020, the committee received the NHI bill and subsequently resumed the processing of the bill through public hearings, nationwide public hearings. We must just note that this was the first nationwide public hearings by a National Assembly committee. And then the world also witnessed the emergence of the COVID-19, which also put a strain on the performance of the committee. Although the committee forged ahead and embraced technology and started having virtual meetings, and this was also the first virtual meeting for the portfolio committee of parliament that the committee hosted during that financial year. In 2020-2021, the committee ensured oversight of the health sector in terms of monitoring of the COVID-19 pandemic and also the vaccine trials, as well as the acquisition and the ultimate rollout of the vaccination program. The committee also saw the election of a new chairperson when Dr. Dlomo left. And then in 2021-2022, the committee concluded the virtual public hearings of the NHI bill and adopted the motion of desirability on the bill. In 2022 and 2023, the committee continued to monitor the COVID-19 vaccination program, as well as the monitoring of the monkeypox outbreak, which remains a public health threat to this day. The committee also visited the Eastern Cape, which was part of the recommendations of the Public Protector of South Africa, the SIU recommendations, as well as the Health Ombudsman's recommendations. In 2023-24, the committee adopted its report on the NHI bill and also the reports on the AMA Treaty. The committee also did a follow-up oversight visit to the Eastern Cape and also received the Tobacco Products and Electronic Delivery Systems Control Bill and subsequently began processing the bill through public hearings. And the committee managed to visit 7 provinces of the 9 provinces. In terms of the constitutional mandates of the committee, which includes oversight and accountability, lawmaking, public involvement, international engagement, and corporate governance, I'm just going to touch on a few issues that the committee undertook oversight visits in 5 of the 9 provinces, and the outstanding provinces were Limpopo, Mpumalanga, Northwest, and Free State. The committee monitored the performance of the Department of Health and its 7 entities, and also adopted the ratification of the AMA Treaty. In terms of lawmaking, the committee processed 3 pieces of legislation: the National Health Amendment Bill, the National Health Insurance Bill, and the Tobacco Products and Electronic Delivery Systems Control Bill. The committee passed the 3 bill. One of the 3 bills it considered, which is the National Health Insurance Bill. The National Amendment the Amendment Bill was considered to be undesirable, and the Tobacco Products and Electronic Delivery System Control Bill is currently under consideration. In terms of public involvement and participation, the committee ensured that its legislation process is central to public participation is central to its processes by ensuring that they request oral and written submissions which were received from a wide range of stakeholders. In terms of international cooperation, the committee engaged with the elders on universal health coverage and also the European Parliament Special Committee for COVID-19. On cooperative governance, the committee ensured that it visits all the public health facilities under the control of the province and national government. In terms of the key areas for future work, the consideration and processing of the tobacco products and electronic delivery system controls bill, which was not completed by the 6th Parliament due to insufficient time. The committee only did the first leg of the public participation process. The committee needs to closely monitor the provincial budgets amid health sector budgets and increasing accruals and medical legal claims. Monitor the implementation of the case management system on medical legal claims. Continue to monitor the implementation of the ideal clinic realization and maintenance program. Also, the continuous monitoring of the state of health delivery across the country. Track the progress on the proposed amendment on the Occupational Diseases in Mines and Works Act. Track the progress on the proposed Health Ombud Bill. In terms of the challenges that emerged, it was the COVID-19 restrictions, parliamentary program that constrained the time available for the committee, lack of dedicated resources to deal with public submissions. In terms of the recommendations, the committee should ensure the follow-up of all committee recommendations on a quarterly basis, ensure that the committee holds frequent engagements with the AG, hold continuous engagement with the 9 provincial departments of health to assess its performance, undertake visits in all 9 provinces, ensure close monitoring of the health sector activities in preparation for the NHI, follow up on the implementation of the health market recommendations, improve on cooperative governance across through cross-sectional engagement, including participation in NCOP activities. I'm going to touch on the department's mandate and its entities and the functions of the committee. I've already mentioned the constitutional mandate of the committee, which basically is to monitor the financial and non-financial performance of the department and its entities and to ensure that national objectives are met. I've already alluded to the purpose of the report. In terms of the activities of the committee held 160 meetings during the 5-year period, processed 3 legislation, undertook 11 oversight trips, held 45 public hearings, which includes both provincial and virtual, and processed 1 international agreement. In terms of the briefings, this section highlights the critical issues that were focused on and issues arising that needs to be followed up, which includes the health market inquiry findings and reports and recommendations reports. The committee resolved to host a workshop with the PC on trade and industry to further scrutinize the recommendations. Another issue was on the investigative report on forced sterilization on women living with HIV and AIDS in public healthcare facilities. The committee called for a comprehensive investigation to be undertaken by the Department of Health. And then it also requested that the committee receive quarterly progress reports on this matter. In terms of the Section 59 investigation interim report, which found that medical schemes such as GEMS and Discovery and MedScheme racially profiled Black health practitioners so that they do not enjoy the same benefits with other races when claiming for rendered services. The committee requested to be briefed by the investigators and the Council for Medical Schemes once the report is finalized. The committee also received a briefing on surgical backlogs in public hospital, and they resolved that there should be a progress report presented to the committee on the status of surgical backlogs in public health facilities. I've already touched on the legislation that the committee processed 3 pieces of legislation and passed the National Health Insurance Bill, The Tobacco Products and Electronic Delivery System Control Bill is still under consideration as it was not completed during the sixth Parliament. In terms of the oversight trips, I will not go through each and every visit, but to say that the committee didn't cover all 9 provinces. However, they managed to do follow-up oversight in provinces such as KZN, Gauteng, and the Eastern Cape. And some of the recommendations were not responded to. So it's important for the committee to actually do the oversight, the follow-up oversight, whether it's in the form of a visit or a meeting with the respective provinces. And then on the study tours, the committee did not undertake any study tour. On international agreements, the committee adopted the treaty for the establishment of the AMA Treaty of the African Medicines Agency. And some of the observations the committee made is that they acknowledge that the significance of Africa's ability to manufacture its own medicines to meet the health needs of its population is important. And they also emphasize that indigenous medicines should also be included in the AU and the AMA. There were no statutory appointments made by the committee. And in terms of the mandate of the committee, that the committee should compile budgetary review and recommendations reports annually. And this is provided for by the Money Bills Act. And the committee made some of the recommendations over the 5-year period that actually stood out, which includes that the department should assist provincial departments to improve on audit outcomes, as 3 provincial departments remain qualified for over 4 consecutive years, which is the Eastern Cape, Free State, and the Northern Cape. Also, the concern were around the budgets of provincial departments, and the committee recommended that the department should develop internal controls and instruments to monitor and eliminate irregular, wasteful, and fruitless expenditure. Medical legal claims continue to deplete provincial departments' budget, and the committee recommended that the department address the factors that contribute to the sharp increase in the claims and implement the national case management system. In terms of the challenges, the lack of responses from the department on previous BRR reports and budget vote recommendation was highlighted. Issues for follow-up includes the stagnation of audit outcomes of the 3 provinces. The national budget spending was not in line with service delivery performance, high budget expenditure, but poor performance against set targets. Continuous findings on quality and reliability of performance data was highlighted. Budget of provincial departments getting depleted by accruals and medical legal claims was also noted. The lack of consequence management for poor performance and transgressions was sharply raised by the previous committee. In terms of the outstanding issues, the national department should ensure that it responds, as well as the entities, to all the committee recommendation within specified time frame, and also provide the committee with the following reports. The reports on consequence management arising from non-compliance with legislation, report on how it's assisting the 3 provinces to improve on its audit outcomes, a report on the implementation of the mental health policy framework. In terms of the entities, the Council for Medical Scheme should provide the following reports. The Section 59 Investigation Panel Report, the SIU Investigation Report, and the progress report on matters relating to the conduct of financial institutions, bills, the COVID bill, and the Financial Sector Regulations Act. The South African Medical Research Council should present on its transformation strategy to the committee, and the Office of the Health Ombudsman, the committee should follow up on the proposed Office of the Health Ombudsman bill. And the provincial department, the committee should engage with all the 9 provincial departments on their performance. I've already spoken to the AMA Treaty, which was adopted by the committee on the 26th of May. In terms of the recommendations, the committee recommended the strengthening of working relationships with other parliamentary committees on cross-cutting issues, including undertaking joint oversight visits. The committee should hold midterm strategic planning sessions to review and amend its 5-year strategic plan. A training of committee members and officials is essential for skills enhancement for effective oversight. A regular committee management meeting to strengthen the committee's planning and communication. There's also a need for a systematic and standard mechanism for ensuring that all issues raised are addressed and detailed responses are presented as part of the reports presented to the committee. I will leave it there, Chairperson. Thank you.
Thank you very much. You may then remove so that I can see the members when they raise their hands. Honorable members, this is the report that is being tabled. Hold on, either Reverend Kwabaza or I see your hand is up. This report, honorable members, is familiar to some of the members, or it's just a reminder to some of the members who have been part of this leadership. It highlights that there are certain provinces that we did not really cover in our visits. Maybe they should be on the top of the list when we start. It also looks into our spaces in terms of, are we visiting the reports of the AG with regards to the department enough? Some of the new members here may need to know and see that there are certain entities that are actually attached to the Department of Health, which we need to familiarize ourselves with: South African Medical Research Council, NHLS, Council for Medical Schemes, SAPRA, and many others, so that we do know what they are actually doing, and therefore how do we then get to meet with them. Very strongly so, honorable members, I wish you could maybe talk to this. There is a medical legal claims, if one department, one province, in particular Eastern Cape, last year spent 900 million on the we should be budgeting 0 or less for such claims, but they had to pay 900 million for that because of things that are actually happening there. There are members issues that colleagues need to follow up here, the surgical backlogs, our own strategic plan. So I would then want to recognize the hands. The hand that came in first was a hand from that gadget of Neta. Now, I don't know who else, whether it's both of them or one of them who want to speak. Who is raising a hand there in that, Honorable Mohots?
Chairperson, it's Mr. Mutubatsi.
Mr. Mutubatsi, okay, fine.
Honorable Mutubatsi, yes.
Mutubatsi. The second,
no.
Okay. We are just taking hands for now. You'll be number 1. The second hand will be that of Honorable Dr. Leroux. The third hand will be that of Honorable Van Staden. The fourth one will be that of Honorable Clark. The fifth and the last for now is the one of Honorable Dr. Tembekwayo. In that order, honorable members, we can then start.
No, thanks very much, Chairperson. I actually want to appreciate the comprehensive report that has been presented, well written. I think it lays the launchpad for one to can flow with the committee. I first want to suggest that we note the report and further suggest that because we are going to have our meeting after this period, then suggest that during that particular meeting, because in the report, the question of training came through, suggest that during that first meeting, then that training be considered if it is possible for new members, and further suggest that we, having noted the report, some of us have gone through the report. There are issues that we want to input on. Suggest perhaps that we make those written submissions to Secretariat to can be able to capture them, and ask Secretariat to develop a plan that will be able to guide us to say that in the coming period of 5 years, these are the issues that this committee would want to focus on. Of course, lifting issues that comes from this particular report and recommendations that have come through on what should actually be considered moving forward. So I'm suggesting that synergy and it be incorporated into that plan. It be presented particular meeting for us to can be able to adopt that this is our plan that will be moving forward. I thank you, Chairperson.
Thank you, Honorable Tibasi. Let's move on to Honorable Dr. Leroux.
Thank you, Chair. And thank you very much for this report. Very helpful for me as a new member to see what you've been doing over the past 5 years. And so I just want to thank you for providing this to us. Just two small points, and I'm not sure if it's possible to make any changes to the report, but there was the one thing I was hoping we could maybe change is just that I see that under point number 3, with all the briefings and public hearings, there weren't actually dates provided for when these hearings happened, and I think that might be useful. And then the second thing is a very small point, but it's there was on page 12 under South African Health Products Regulatory Authority, they talk about that user abbreviation, which I do not understand, and of IVDs, and perhaps that could just be clarified. But those are my only comments, and thank you for that.
Thank you, Honorable Leroux, Dr. Leroux. Honorable Van Staden.
Thank you, Chairperson. Chairperson, I have one problem, and it's under point 4.3 of a tobacco products control bill. The status say they're in progress. But if you look at Rule 333 of the National Assembly Rule, Sub-Rule 2, it states that all bills before the Assembly or any Assembly Committee on the last sitting day of a term of the Assembly or when the Assembly is dissolved lapse at the end of the day. So it is my conclusion, Chairperson, that this bill can't be in progress. According to this rules of the National Assembly, the bill has lapsed, and then we must rather say that the bill must be, the rules, Rule 286 must be adhered to according to the rules. And I see that the bills before Parliament, which was also issued on the 19th of July, the bill is currently not before the committee. So I just want to draw your attention on that the status cannot be in progress. Thank you, Chairperson.
Thank you, Honorable Van Staden. Honorable Clark.
Thank you, Chairperson. I concur with Member Van Staden. I wanted clarity in terms of that very issue, in terms of the bill, so that, the rule does prescribe that the bill has lapsed and that we have to restart. So if you could please give us clarity on that issue. Then secondly, also, I'm very happy that you are going to allow for us to put recommendations forward from this report, because I think it forms a critical part of our strategic plan for the next 5 years. Because just getting back to the tobacco bill, I mean, there has been a big emphasis put on that bill, that bill should be referred to NEDLAG, and that is something we must do. And then in terms of the SONA reply of the President, he also mentioned that there should be a much wider consultation with stakeholders in terms of the NHI bill as well. And that is something we're really going to have to also add into our strategic planning for the next coming year. Thank you, Chairperson.
Thank you very much. Honorable Dr. Thembekwayo.
Thank you, Chairperson. And let me start by acknowledging and appreciate the efforts taken by the Secretariat, including the researchers and the presenter. I mean, they did a lot of work, and even the structure thereof is the best. So they need to be acknowledged for doing such a splendid job. But what I want to suggest is that this is a piece that can guide us towards our planning, which obviously means our planning should not be, our planning for 5 years should never be on virtual, but it should be a working type of a meeting where we will all engage and be able to arrive at the planning for 5 years, where every one of us will be satisfied about the issues that we will move on in this period of 5 years. So Chairperson, if it's possible, when we meet after the recess, we are supposed to be seated and be able to engage on these matters. When it comes to the Waco bill, I mean, we were there, few of us, because the rest have fallen out. But the returning members knows about the security issues. So the chairperson must go and find out to say which rule can allow us to complete the 4 provinces that were there, rather than going to restart. It was very bad during the time when we were doing the tobacco bill thing, public hearings, very bad, and they all know how it was. So it's upon the chairperson to go and check on what is it that works, because according to me, we can simply go to the 4 outstanding provinces and then conclude them, so that there can be the summary of the findings on what transpired or what the public is saying pertaining to the tobacco bill. But it's a matter that we will engage on, is the matter that will also be guided by our chairperson. Most important, during the 5 years period, we never had any study tour. Not to say we never had, but there was always a planning approved, sometimes a week before we could go. The trip would be cancelled. I don't know how many times. We need to go somewhere in all those countries where the NHI is a success, so that we can go and learn what is it that made this to be a success and apply it here. Because doing something of such a nature, NHI bill, and making sure that it should work, it will never work if it's not compared to other standards on international level. So I would say, even in our coming planning, we should make sure that at least every year, it's 5 years, every year or twice in a year, we go on an international tour like all other departments. I am just having a problem to say, I don't know what our previous chairperson was saying, because I think he was cancelling anything that had to do with the study tour, and hoping that Dr. Dlomo, you are not going to follow that way of cancelling any study tour that would be proposed. So I'm in agreement that we definitely have to sit down and plan together and be able to have a transformative type of 5 years where the service delivery would be the best of the best. Thank you.
Okay, I see Honorable Van Staden wants to come back for one short addition.
Thank you, Chairperson. Now, I concur with all the colleagues who spoke before me about this matter. Yes, indeed, we have to have a physical meeting for this planning, for our committee program for the following 5 years. So I want to put the suggestion on the table, but we do not accept this report today, but that we took it back, and when after the recess, when we have a physical meeting with the planning for the department's program, the committee's program forward for the next 5 years, when we look at this report again, so that we can now not adopt it today, but that we can refer to the next meeting. Thank you, Chair.
Honorable Shabangu. Yeah, last is this. Honorable members, normally we do this in this committee. We put all our hands. I've given you number 1, 2, 3, 4 at a go. Then I now know that all hands have been completed. I see there's a new 2 hands, one of Honorable Shabangu and the other one of Kilachiwe. So let's maybe in practice in future do that. We all raise our hands at the same time. Then I note and give you numbers, then you can start. Start with Honorable Shabangu now.
Thank you, Honorable, and greetings to members. And let me also join others in appreciating the well-compiled report. The Honorable Chair, the report that we are getting, for my understanding is that this report, it's giving us the information of what happened in the 6th administration. We were not there, though some of us, they were part of that portfolio committee. And giving us the information, it assists us to plan in the next coming 5 years. So to adopt or not to adopt the report, I don't know whether it's relevant because it's a report that is giving us information and recommendations so that we can have our strategic plan going forward. But I want the reason I'm raising my hand is because I need a clarity of it's, for me, I understand that it's not a report that we're supposed to adopt or not adopt. It's a legacy report that will assist us planning strategically going forward. Thank you, Honorable Chair.
Thank you very much, Chair. Sorry for that. Now I noticed that your request was sparked by contribution of Honorable Van Staden. I will address that when we have finished. Thank you very much. Honorable Kihakiwe.
Thank you, Chair. And let me also appreciate a well-written, informative report. And as a new member, I think this report, it is straight to the point. The only reason that can be said that you are not going to adopt this report is only when somebody is saying this is not the true reflection. But for some of us, because we are new, we just have to accept the report as it is and move forward. We do not have enough time. People are waiting for the services. And then my second point is with regard to the issue of us going on recess back to our constituencies. As a new member, I really do not know what is expected from me when I go back. So if we can be guided as to what is it that we are going to look for and what is it that we are expected to report on when we come back from the recess. That is my input, Chair. Thank you.
Yeah, Honorable Van Staden, before you come back, let me just talk to what you raised. Honorable members, this is a legacy report that I think at best we can note it. It's a useful report that helps us to move on without ignoring what was done and what was outstanding after that. So I think one could really leave it at that to say it's not necessarily calls for a formal adoption. We could accept it as part of the provision of our work going forward, and therefore would actually have to leave it at that space. But let me hear what Honorable Van Staden is saying. His hand is up again.
Thank you, Chair. That is exactly what I meant, actually. Let's go. What I'm trying to say is we take note of the report, but let's go back and study it in the recess time before we came back after the recess. And when we came back after the recess, we have studied this report thoroughly, and then we can continue our planning for this committee program for the next 5 years. Thank you.
Okay. No, thank you very much, honorable members. In fact, I would really request Ms. Machalamba or those who are helping her to then address the issue of there are no dates on the public hearings, if it would be difficult to insert that, and also another clarity on a certain abbreviation on the SAPRA issues and any other things that they could really raise on. But let me then come to the members. Thank you very much for your participation. In fact, indeed, this report and this meeting is confirmed by your comments that it was necessary. One, it is actually giving us a pick up what actually was done by our honorable members who were there in the sixth administration. But number two is a provision for us to go out as a honorable member who spoke first, saying it's allowing us then to create a plan. I do take the point he's raising. We can either forward our comments to the secretary, but again, I would also like this idea of Dr. Tembekwayo that we can then in a first physical meeting bring together all the points and align them to say this is what we would like to see happening in the next 5 years by this committee and plan together. So getting this meeting ongoing and also assisting us with that break, recess, we would then be able to move on in that space. Let me address some of the issues that were raised by the members, starting from Honorable Van Staden, supported by Honorable Clark. I had a meeting yesterday with Honorable Frolick, having read this report and also seeing that the tobacco bill in progress, as to say what actually is the status of this bill. And then this is the information that comes in there, that all bills that have not seen their space in completion by committees or in the full house have lapsed, have now lapsed into being there. However, we do have a report by this committee of what actually happened on that bill. So now the onus will be on the ministers responsible, now all ministers, including health, all ministers approaching the leader of government business to say, there's a bill that we sent to Parliament, it lapsed, we want to either get it off completely or we'd like to resuscitate it. So I then, having had that meeting with the Honorable Frolick, briefed the minister to say this bill is off our radar. We're not going to touch it until there's an initiation from your side, if you so desire. And therefore, that process is, as members have raised it, that it will have to come back. Obviously, we will have to actually incorporate what Dr. Tembekwayo is saying. You can't ignore a report that is sitting here and start one province again. You might have, when it comes back, consider that some work has been done by the colleagues and maybe finish off that part. But we are not going to start with that now in the light of the report in the report that it has to start all over again. Obviously, we'll have to get the benefit of the minister coming back to start and brief us again for the benefit largely of the new members so that we could really understand the bill and then maybe continue thereof. Including, let me just say, Honorable Clark is correct. There has been a pronouncement, so once the president speaks, so all of us have to follow, to say there should continuously be dialogues, not only on NHI, but on all other issues that, just to put it, the DA is having a universal health coverage, but not this model of NHI. So there may be areas where they could be finding each other much easier and better. So continuous dialogues will quickly come into that space. I think this committee must really be very happy, though sad, that we did not have an international tours last administration. So if you do request this time around, I don't foresee anyone blocking or stopping, because there are actually, as Dr. Tembekwayo is saying, certain things that we will also want to be appraised, compare with other countries, but also new other things that we lead to that are going to come up. So at least it is now written down. The Portfolio Committee of Health in the sixth administration did not have any international tours or study tours. Therefore, it will be very difficult to stop that committee making a new request going forward. So I will also be able to handle it and support it in that space. So those that have remained, let me see. I would want to say, for now, we would probably, there's been an issue of a request by a particular some honorable members, should we or should we not? Let's actually make sure we come back, Honorable Ikhakiwe, in terms of what would be our constituency work during this recess. If there is any, I could forward that, but there's always been some request. Should we or should we not do it the way it has happened before? I wake up and go to clinic A, and then the next hour, another honorable member goes to the same clinic A, and then the last hour of the day, the same member goes to clinic A. And therefore, you then say, as they take me around that clinic A, none of the staff members are able to work. Let us probably park that until we can find ourselves and agree to say, yes, clinic A needs to be visited, but how do we deal with it? Maybe individually or coordinated it or alert them this, that, and the other. For now, I would say, I guess ibambe kanjalo, and request Honorable Ms. Majalamba or Mbali to then answer on those questions asked by Honorable Dr. Leroux.
Thank you, Chair. In terms of the acronym, IVD is vitro diagnostic products. And then in terms of the dates for the public hearings, we can just that the template was restrictive, but we can provide the hearings held as reported as per the report. Thank you.
Okay. Honorable members, thank you very much. With that, can we then agree that we do have this provision? Can we request honorable members to do one or both of these? During the recess, we are able to read through this document again. If there are any other issues, we would like to forward them to Lindogushe or Ms. Machalamba. But we also agree that our first meeting will be to try and draft a plan for ourselves based on what we think we see in the country happening, and also what we would read through the report. I would really wish, honorable members, that our medical legal issues becomes the top of the agenda. Request that we look into not only get the AG to visit us when there is an issue, but just to say, AG, are things going well in the department? And number three, also in the entities. And number three, we really do kickstart visits to provinces. I would wish that honorable members look into it in that way. Some of the visits to provinces, we can interact with provinces in two ways. MEC, HOD would be logged in this afternoon with you. We want to hear this, that, and the other. But the next day, I mean, that could probably be after as a follow-up. But we also have another visit physically into. So I think we should probably look into that possibility, honorable members, to say our visits to province or interaction with provinces can be in two ways. A follow-up, or say, we are not coming yet, tell us about this incident at this hospital, brief us this, that, and other, so that we could be appraised quickly, faster. But again, not rule out our physical visits to provinces. If you could also look into that when we do come back. Will there be a challenge, honorable members, if we move out of this agenda item now and go to minutes?
No challenge. Thank you, Chair.
Thank you very much, Honorable Gwabaza. There's a hand. Honorable Van Staden is supporting Honorable Dr. Tembekwa that we should move on to another item now. And then I see a hand in that one of Nceda. Yes, Honorable Member.
No, Chair, I support this, Mr. Mutubatsi, Honorable Mutubatsi.
Honorable Mutubatsi. Thank you very much. Can we then, Ms. Machalamba, flight the minutes for us? I take it they've been read and it's a short one. Mainly members, as this come through, just firstly start checking if your name does appear there and that you were part of this meeting. And then if there is any name that is not there or apologies that we're not seeing, please tell us, and then can move down, Honorable Ms. Lindo. That we're mainly considering this report whether it should go in. And honorable members said, look, they do reserve their right to not to support the report, but we noted those and they are captured here in this space. And therefore, the resolutions were that the issue of teenage pregnancy should be part of the committee's focus areas. So I note that we are pushing that up already. This is what honorable members we are sending are things that we need to do. And then the committee should also appraise the progress of identifying ex-mine workers. I would also want to say, Ms. Sene being here, TB in the mines is something that must also be part of what we are doing. The unclaimed bodies, that's also my real desire. The unclaimed bodies, this committee has been asking quite a lot. So these ones are the ones that came up, honorable members. Police portfolio committee to discuss issues of security in public institutions, and then our visibility in provinces. Can we therefore adopt, honorable members, these minutes of this last meeting as a true reflection of our discussions? If so, may I see by a show of hands? Honorable Mutubatsi is calling. Let me hear what you are saying, Honorable Mutubatsi. Honorable Mutubatsi. Okay, is struggling there. I see a hand only. Any member who wants to comment about the adoption of these minutes? Can we adopt?
I move for adoption, Chair.
Honorable Van Staden moves for adoption, and then Honorable Clark.
I move to second.
Okay, thank you very much. Thanks. And I also see Honorable Shabang wanted to say the same, I suppose. So the minutes
Yes,
have
Chair, I wanted to say the same thing. Sorry, the gadget, sorry. Thanks, Chair. I wanted to say the
Thank
same
you,
thing,
Honorable
your job.
Mutubatsi.
And also as a rider, that of course, this resolution be lifted to our planning because I see they are very good.
Which one, Honorable Mutubatsi?
No. I was saying the resolutions that we took, they be incorporated in our way forward, moving into that strategic plan.
Absolutely. Please pull them up, Ms. Machalamba, on the day we meet physically. Thank you very much. Honorable members, this therefore concludes our business for the day. Thank you very much for this, and I hope, and I'm really looking forward. We'll speak with the secretary whether we book much earlier so that we could get a venue as soon as possible. I don't think, honorable members, if we do call a meeting the first week we come back, honorable members will say, oh, no, I don't know what are we talking about. We'll actually be putting together. We get that over and done with, then we know how to start with our work. So if members do agree, my secretary and the secretary might actually pull that meeting on the very same week we are back, and therefore be able to align ourselves. I'm very grateful members have got a provision to start from in terms of our preparations. Thank you very much, and the meeting is adjourned.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Thank you.
Chair.
Thank you, Chair.
Bye-bye. Bye-bye.
So, and now, so it's half hour. Yeah. So what I'm going to do, I'm going to suggest